welcome. My name is Angie Backey, and I'm the Executive Director with Doctors for America. And I'm so excited to welcome you to this special educational event and talk about a powerhouse of individuals representing some really incredible organizations. So, again, very glad you're here. If you're not familiar with Doctors for America or DFA for the sake of time, we are a national nonprofit organization that mobilizes over 40,000 physicians and medical trainees to advocate for policies that improve the health of patients and communities. And through advocacy training and action at both the state and federal level, our work really focuses on expanding access to affordable care, promoting community health and prevention, and of course, advancing health justice and equity. Now, Doctors for America does not accept funding from pharmaceutical companies, medical device manufacturers, insurance companies, or for profit entities, which allows us to remain fiercely independent and patient centered in all of our work. And so we are the organization that puts patients over politics and patients over profits. Today, we're going to be live streaming this presentation to Facebook Live as well as recording it, and all materials will be available afterwards. So before we get started, a couple of quick ground rules for this educational session. Number one, we welcome your questions. Please remember to use the Q&A feature on Zoom, and we'll address your questions during the second half of our session. And also look out for comments in the chat. A team member will be sharing helpful links during this session that I think will be really useful for your advocacy following today's presentation. Now on to our moderator. We are so thrilled to welcome Dr. Stella Saffo. Dr. Saffo is board certified HIV primary care physician. She's a public health advocate and the founder of Just Equity for Health, which is a healthcare improvement company that uses advocacy, education, and care model design to ensure equitable care delivery across all sectors of medicine. Dr. Saffo has experience in clinical transformation and healthcare redesign at Mount Sinai Health System and Premier Incorporated, where she respectively serves as an assistant professor and a strategic advisor. In addition to her commitment to population health and care model design, Dr. Saffo is dedicated to equity within healthcare, and she is the founding member of several organizations dedicated to gender and racial equity and to civic engagement in medicine, including Equity Now at Mount Sinai and Civic Health Alliance, which she is here representing today. Dr. Saffo also provides clinical care to patients in New York, and her work has been featured in various academic and popular media, including CNN and MSNBC. Welcome, Dr. Saffo.
Thank you so much, Angie, and it's such a pleasure to be here representing Civic Health Alliance. As the co-hosts for this session, I wanted to tell you what Civic Health Alliance does. We are a nonprofit organization that really has this mission of advancing America's health through civic engagement in our communities. And we focus on two particular areas. We focus on the why this is important within healthcare, and we focus on how we can do it. These webinars and these sessions and this time with you is a part of that movement to be able to bring that work forward. You can learn more about what we do on our website, which we'll be able to share shortly. But one of the things that we really, really believe in is we have to make it easy for healthcare workers to be civically engaged. And so if you're thinking, how do I do this work? Am I allowed to do this work? Are there resources that I can use to do this work? If you go onto our website, you'll be able to find all of those materials, download them, and be able to use them right away to get started. I have the pleasure today of introducing some incredible speakers who will be working with us to really understand what's happening in the current healthcare landscape now that H.R.1 has been passed. We felt it was very important to have this session in part because there is this sense now that H.R.1 has been passed that there's not much that we can do. It isn't clear kind of what's going to happen now for clinics, our communities, our patients. There is a tremendous amount that we can do, and I want to bring that message of hope through our three speakers. Please let me introduce them. Laura Packard is a stage 4 cancer survivor and patient advocate, and she's based outside of Washington, D.C. She founded the nonprofit Healthcare Voices in 2018 after her own cancer journey. And she founded it to help adults with serious medical conditions and healthcare activists across the country to make healthcare in America more affordable and available for all. This group educates the public on healthcare issues through social media. They answer healthcare questions and questions around insurance, and they offer free online media training programs as well. This advocacy work is extremely important, and we are very, very happy to have Laura here with us today. Next, we have Layla Ogabian from the Economic Security Project. She's a legislative advocate, and she helps to run ESP's federal advocacy campaign to expand cash tax credits and check corporate power. She has over a decade of experience in issue advocacy, and she's worked to transform the Iranian American community into a well-organized electorate. She has directed a statewide ballot initiative campaign to repeal the death penalty, and she's also advocated for the rights of people with disabilities. And we're very lucky because Layla will be sharing with us today some very practical tips of what we can all do now. Finally, we have Mason Quartz, who is a clinical instructor at the Harvard Law School of Cyber Law Clinic, where he's worked since 2017. He uses his legal training and background as a software and database developer to bring a technical perspective to issues such as civil rights, government transparency, and police oversight. He supervises students in the Cyber Law Clinic on projects such as public records lawsuits, amicus briefs, administrative comments, and client advising, to name just a few. So we're going to hear from this group, and we're going to start off with Laura.
Thank you so much. And thank you, everybody, for joining us today. Let's start by being realistic. The news this year has been bad, really bad for healthcare. And you may be feeling angry, sad, depressed, demoralized, all of those things. And that's completely understandable because the news is bad. H.R.1 cuts $1 trillion from our healthcare system, and people across the country will be affected. But just because this has become law does not mean that we can't fight the bad provisions in it, because many of these do not take effect right away, which gives us time to fight back. So we lost the fight to stop this law from being enacted. But the fight is not over because it hasn't taken effect. And even if it did take effect tomorrow, we could still keep fighting. The news this week, healthcare champions were elected across the country. And I think it's pretty clear that the American public at large is not happy with the way things are going. And that is also helpful for us because it may feel like some elected officials are not listening to you, but it is hard to ignore millions of Americans in states like Massachusetts and New Jersey, yes, but also in states like Mississippi. People showed they are not happy with the way things are going. So we need to work with that. And our next few speakers will be giving you practical tips on what you should do. But the general gist of it is you should be contacting your elected officials. Whether or not they seem to be receptive, they still need to hear from you and they need to keep hearing from you. And surprisingly, people that you would think that were not listening may actually be listening. Marjorie Taylor Greene speaking out about the importance of affordable ACA health insurance policies, which is not something that people would have predicted. But again, that is because people in her district have kept contacting her, and she's hearing about it. So don't write off anybody. You may feel like your congressperson, your senators are not listening, but you still need to keep making the contacts. And you may eventually make some surprising successes there. This issue is personal for me because, as mentioned in the intro, I was diagnosed with cancer 8 years ago, and this was happening at the same time as the fight to repeal the Affordable Care Act, which is keeping me alive. So I went from chemo sessions to speaking out outside my senator's office, And that was my spring, summer, fall, winter of 2017. And it is unfortunate that we are here again 8 years later with millions of Americans facing severe threats to our healthcare. But I don't like that we're having to do this all over again, but it is what it is. And we need to keep up the fight because the damage is only done if we stop fighting. Many of the cuts have not happened yet, and we may be able to stop them from happening altogether. The government is shut down right now, and there are many reasons for that, but part of that is over Affordable Care Act health insurance premiums and keeping them affordable. So it is important, again, contact your legislators and make sure that they know that you want them to take action to keep health insurance affordable, to keep fighting, to not just give in and let these cuts happen because they have the power to do something. And if they are motivated enough, perhaps they will take action, which again goes back to people power. Because any elected official is in office because they got more votes than the other people. And again, the election results this week shows that Americans are not happy and that every elected official should be afraid for their own reelection if people are so unhappy about healthcare. So you need to make sure they know that you're not happy about healthcare and what you want them to do about it. And as physicians, as medical personnel, I think it's important also to educate as much as you feel comfortable and are allowed to. Educate the people you come in contact with because you have an authority as a medical professional. The people will listen to you and take your opinion and expertise seriously. So you can explain things that people may not understand. Like one of the talking points about this health insurance fight is that money is going to um, undocumented people, and that's but the thing is all of these programs, it's part of the program that it's limited to who can access them. So not going to get into the details too much, but there are false things floating around given as an explanation for why elected officials don't support making health insurance affordable. And you can help educate and inform things that are not true and just bring it back to Americans deserve health care. We do not need a $1 trillion cut to our healthcare, which will affect everybody one way or another. If you have Medicaid or not, if your local hospital closes, that means that everybody in your community is going to be affected. Or even if your local hospital doesn't close, but another one in your state closes, all of those people will be going to your hospital, creating extreme wait times and so on. So we're all in this together. We all are in the same health care delivery system together, even if we have different methods of payment. So a cut to one program affects everybody, whether or not people recognize that they are on Medicaid. And that's another issue in that state Medicaid programs go by different names. And so people may not even be aware that they are directly affected by cuts. But again, indirectly, everyone is affected by $1 trillion in healthcare cuts. And we need our elected officials to stop these cuts because our lives depend on it.
Well said. It felt important for us to start with you, Laura, because we always locate what we're doing within patients, and your story of overcoming and continuing to fight is really inspiring. And I think you are giving us the call that we cannot stop fighting despite what feels like a very hard and tough and negative time. So thank you, thank you, thank you for those comments. And we want to get into some of the specifics around exactly what it is that we're asking you all to be thinking about as we think about what it is we can do with the advocacy. And part of that is understanding where we are with this bill, what's in it, what do we need to understand around its impact on healthcare. And for that, I will turn it over to Layla.
Thank you so much, Stella. And hello, everyone. My name is Layla Ogabian, and I am a legislative advocate with Economic Security Project, which is an ideas advocacy-based organization that works to build economic power for all Americans. And I work on issues around addressing affordability. And right now, we're focused on the rising cost of healthcare. And it's my job to work with Congress and make them do better. And there are a number of ways to do that. But for today, we are going to focus on the element of storytelling and how you can tell your story to advocate. But first, I do want to go into an overview of H.R.1, the One Big Beautiful Bill Act, and show you how it actually took a wrecking ball to our healthcare system, all to give tax breaks to billionaires and big corporations. And so, as you can see, between gutting Medicaid and CHIP and letting the ACA tax credits expire, H.R.1 kicks off 15 million Americans off their health insurance, and it more than doubles the premiums for 22 million who are getting their insurance through the ACA marketplace. And in addition to that, it also cuts SNAP benefits for over 4 million recipients. So you can imagine you're not only going to have patients that have lost coverage, but you're also going to see more hungrier patients. And so H.R.1 does this, cuts healthcare for 15 million people in a number of ways. First, as you already heard, it cuts Medicaid and CHIP funding by $1 trillion, effectively resulting in 7.5 million individuals losing their healthcare through those two programs. It also doubles the premiums that we're seeing in the ACA marketplace because Congress failed to extend the enhanced premium tax credits that help cover the cost of skyrocketing insurance. And so right now, today, 22 million people are being faced with skyrocketing premiums because of Congress's failure to extend those tax credits. In addition to that, we also saw changes to the ACA rules, which will effectively kick off 3 million people from coverage. And then also H.R.1 triggers about $500 billion in cuts to Medicare, which benefit the elderly and the disabled. And so we're going to see a lot of impact to Medicare as well. Next slide, please. And so actually, as Laura had pointed out to earlier, we have time to fight back because certain provisions don't kick in until later on. And so I'm actually going to go through that timeline and pinpoint key moments in time when your stories can be particularly impactful in this fight to try and repeal these cuts. And so all of the provisions in H.R.1 related to healthcare don't actually go into effect immediately. They all go into effect at certain points in time. And the folks who crafted this bill knew it would be politically unpopular. And so they designed it in a way that the Medicaid cuts actually don't kick in until after the midterm elections. But what does go into effect immediately are the tax breaks for billionaires and big corporations. Right now, in this moment in time, as you can see in this timeline, we are faced with skyrocketing premiums in the ACA marketplace. One of the things that H.R.1 did is it actually shortened the open enrollment window. It used to be about 3 months. Now it's about 6 weeks. So we're in that November 1st to December 15th window where 22 million people are being faced with skyrocketing premiums. And then by January 1st, all of those 22 million recipients are actually going to be paying those higher premiums unless Congress acts to reverse that by extending the enhanced premium tax credits. And then after that, what we're going to see in the summer of 2026 is Medicaid recipients are going to have to start verifying their employment in order to keep their coverage. And so in the summer of 2026 is when we'll see that verification process happen. And then shortly after that, we are in the midterm elections. Next slide, please. And so then what you'll actually see again is by January 1st, those work requirements kick in. And then what you're going to see effectively happen is 5.3 million people are going to lose coverage because of those work requirements because they just can't meet those requirements. And then after that, what you're going to see in October of 2027 is you're going to see restrictions on provider taxes kick in. And this is a mechanism for states to produce the revenue they need in order to fund Medicaid. But because they are being restricted, they are not going to be able to produce that revenue, and therefore will have to make cuts to those programs, which will also further result in loss of coverage. And then you go 1 year ahead in October of 2028, and then that's when you see the $35 Medicaid copay kick in, which will directly impact low-income Medicaid recipients who will not be able to afford that. So again, you'll also see an additional loss of coverage there, and that's how we get to the 15 million losing coverage because of the cuts in H.R.1. And then shortly after that, October 1st, of 2028, we get to November, and that's when the presidential election hits. And so you can see there are moments in time, key moments in time, where your stories will be particularly impactful and powerful. And you can see that in this timeline here. And so with that, I'll go ahead and pass it over to Mason. Thank you.
All right, thanks everyone. So Layla's going to talk a little bit more after me about effective storytelling and how, how to get your experiences, your message out there. I just want to talk to you a little bit before that about how to do that in a way that is safe and protects you legally. I'll say before going into this, I am a lawyer. The advice I give here is going to be very general. I hope what I can do is at least give you some sense of like when it is important to be able to talk to a lawyer who could be with an organization you work at or could be an independent lawyer, and when you are protected by the law. So I'll dive in by on the next slide. I'll talk about three kind of threats to free speech that we've seen recently. These are very general, but some of them have been either particularly difficult in the healthcare area, or have particular implications for healthcare workers. So the one we hear most about is people are worried about threats to free speech from their employer, right? So some sort of adverse employment action, which is just a legal term for being fired, being denied a promotion, not being hired in the first place, being given undesirable work or work that's not commensurate with your experience. People are worried if I say something that is controversial, right? If I speak on a controversial topic, if I say something that's unpopular, my employer might do something against me. And that's a very valid concern. Fortunately, there are some protections in place, which I'll talk about soon. The next one, another very common area we've heard about is people who are worried that something's going to happen from the government. Sorry, I just realized this got cut off. Some people are worried that, for example, like licensing certifications will be withheld, grant funding will be withheld. We've certainly seen that based on the, perceived political bent of an institution or a particular research project. But also, some folks are, worried about immigration status. Either maybe they're here on a visa, they're here on a green card, they have a family member who is not a permanent resident or not a citizen here. And there's a lot of concern right now, especially as we have seen the threat of immigration enforcement or denial of immigration benefits really being used as leverage against people. And then the third bucket is other actors, right? Not your employer, not your government, just someone else out there, right? So you go on social media and then you find out that your address, your place of work, your family's information has been leaked on some dark web forum, and now you're getting death threats, right? Now you're getting harassed on social media. Unfortunately, in extreme cases, this even spills over into in-person confrontations. Another thing that we've seen some of, fortunately not a lot yet, but I certainly have some concerns about, is false reporting of various violations, right? Healthcare providers in a regulated profession, are held to a very high standard, and there are quite reasonably mechanisms for reporting when someone fails to live up to those standards. The downside of that is it gives a very effective vector for attacking physicians for their speech. And we have seen already false or exaggerated claims about the types of healthcare people provide, about whether that healthcare is effective, whether there is misinformation, certainly reproductive care, gender affirming care, vaccinations. So certainly healthcare has, is a very politically charged topic right now in many ways. So what I'm going to do is I'm going to go through each of these sections and just talk very briefly about what you can expect, what kind of protections you have, and how you can keep yourself safe. So next slide, I will talk about employers. Um, so one of the important things to understand here is that employers' strongest interest, legal interest in kind of regulating what you say is on the job speech, right? So if you are in the clinic talking to a patient and you are giving incorrect medical advice, that's a valid concern that employers have, and you can be held accountable for that just the way anyone else can be held accountable for poor job performance. Where things kind of get blurrier is when you are talking about things related to healthcare, for example, the impacts of H.R.1 on the healthcare industry as a whole, or on patient outcomes, or on the availability of insurance, where you're not talking one-on-one with a patient, where you're talking more in your role as a person who's involved in the healthcare industry, but not as anyone's specific provider. So one thing to remember is that healthcare professionals, have heightened ethical obligations that can sometimes cut in favor or against certain speech. And some of these obligations, for example, we have seen people wondering, like, is it okay for me to express my political opinion if that might alienate a patient, right? Does my duty to provide the best care for my patients and needing that trust mean that I should remain politically neutral? And the answer to that, and obviously, this is an ethical obligation. You should all make your own call. But in terms of the ability to be disciplined or have your license removed, the answer is no. You do not have an obligation to remain politically neutral, right? If you view your ethical obligation to provide care for your patients as defending access to health insurance, you should absolutely take that opportunity. So don't let your employer tell you that part of your job description is remaining silent. That is not the case. Also, some people have questions about talking within the workplace, right? If you're talking to your other fellow physicians or healthcare providers about what HR1 is going to do and how you're going to continue to operate and what's going to happen to those patients who have serious health issues but are about to lose their insurance, you are talking about work conditions. And anytime two or more people are talking about the conditions of their work, there's the potential that that is protected by labor law. So again, just as it's not part of your job to remain silent about political issues, we often see employers saying, we don't want you talking about these issues in the office. It's hurting morale. I will say outside of healthcare, we often run into this in saying, don't talk about pay in the office because it hurts morale, right? Well, it's not that it's hurting morale. It's that people are getting upset when they realize that pay is disparate. So workplace speech is often protected by labor law, right? If your employer is saying you're not allowed to talk about politics at the office, then you might want to consider talking to a labor lawyer, especially if you're represented by a union, because when you're talking about the conditions of the work you have to do, that is protected by the National Labor Relations Act. The number one key takeaway here is the best thing you can do to kind of self-protect is make sure there's a clear distinction between your public speech, by which I mean speech that is outside of the clinic-patient relationship. Make sure that you make it clear that you're talking about that in your personal capacity as a physician, based on your personal experiences, and not as a representative of your organization. A common tip people here give is if you're going to wear a white coat to a protest or a rally or to a speech, wear one that with your name or initials on it, but not your organization, your employer's name on it. Another thing is, to say if you say, like, you can say, I'm a nurse practitioner and I work in New York City, or I'm an OBGYN and I work in an underserved rural area. That's fine. If you say the name of your institution, that's not unlawful. You're not necessarily going to get in trouble, but you're putting your employer in a situation where they might feel more skittish. They might feel a little nervous. So if your specific employer or your specific institution is not relevant to the statement you're making, then you don't need to mention them by name. And that's an easy way to get your point across without risking retaliation from your employer. Next slide, please. Yeah, government, we hear a lot of concerns from licensing, immigration status, everything like that. Licensing boards are state run, not federal. This is an important thing to remember. The federal government is very hostile to certain health related speech right now. States are state by state. You will have to talk to folks locally. Federal grants, unfortunately, we have seen are susceptible to interference. Um, uh, of course, this is an area where your institution is maybe more likely to stand up for you because they benefit from those grants as well. Important to remember for those of you who work for federal agencies, who work for the VA, or work for some other government employer, they have to comply with the First Amendment as well. Just because they're your employer does not mean they stop being a government agency. They do have to protect your speech rights. I will say this. There's a special note here. If you are not a citizen of the United States, if you are here on a visa, if you're here on a green card, any other condition, you are probably at the highest risk right now. That is the area where the federal government has the most discretion, the most power, and honestly, we are seeing it wield that power in terrible ways to punish people for their speech. And unfortunately, because there's so much discretion there, the First Amendment is less of a protection. So this next thing I'm about to say is with the caveat of this applies if you are confident in your citizenship status here, do not default to advanced compliance, right? There are so many things that are coming out of the federal government, including many of these executive orders that are probably unenforceable, but they're just hoping that people will comply in advance anyway and not challenge them. So actually, you have a lot of speech protections against the government. If you are not in a particularly high risk class, like being here on a visa, there is no need to default to compliance with some of these illegal orders that are coming out of the federal government. And then really quickly on the last slide, what to do about your safety online. So next slide, please. Um, Unfortunately, there's the fewest legal protection here. Most doxing, harassment, and threats online are not legally actionable. It has to be a threat that is clear, directed at you, and that the person is actually capable of carrying out before it becomes something that you can report to the police. Um, However, there is some potential for relief through platform rules. Most platforms will remove very harassing or aggressive speech, even if it does not cross the line into illegal speech or criminally punishable speech. But the best approach is to protect yourself. Curate your online presence. Don't accept friend requests from people you don't know. Block, block, block. Anyone who harasses you, you do not need to give them your attention. You do not need to waste your limited emotional bandwidth on them. Just ignore them. And I'll say here, there are several good online guides to follow. I will say here, you can go to the Electronic Frontier Foundation has a very good one, as well as the New York Civil Liberties Union. I'm happy to share those links out afterwards through the organizers. But when it comes to protecting yourself against the, just kind of like public actors, especially online, unfortunately, this is an area where the best thing to do is to protect yourself because there is not a lot of legal protection available for you. That's a very quick overview. I just wanted to give that to you so that as you're thinking about how to tell your story, you can think about what are the things I need to be concerned about. Um, and can you do you need to talk to a lawyer? Do you need to get some kind of special help? All right, and with that, I will turn it back to Layla.
Thank you
Thank you so much, Mason. Go ahead, Layla.
Of course. So I know we're at a time where it seems like there's nothing you can do, but I'm here to tell you that there is something that you can do. I am on the Hill every week, on Capitol Hill every week, and I see how stories have power and are making a difference. Those that voted for H.R.1 are lying about the impacts, and people are using their stories as one way to push back and resist. And so I am now here to tell you and show you how you can use your story to advocate for a better healthcare system. Next slide. And so first I want to take a step back and actually look at the bigger picture. Why is this important? Why now? And why you as healthcare professionals are important in this fight. And first, as you heard, people are on the brink of losing their healthcare. Right now, people are making the choice between healthcare and staying fed or paying their rent because the cost of living is just too high. And then second, you as healthcare professionals are on the front line keeping people healthy, and your stories are important. Healthcare professionals are trusted messengers and validators. And the most important piece of any action is sharing your personal stories and sharing the stories of those directly impacted by these healthcare cuts. 22 million people are at risk of premium skyrockets, and 15 million people are going to lose their health care, all to fund billionaire tax cuts. I want you to think about what this means for you in your day-to-day practice, what impact H.R.1 will have on your patients and your efforts to keep people healthy. Just this week, I was in an advocacy meeting with a doctor from Alaska talking about the healthcare crisis, and he said he never expected to be part of a practice where he had to see people choosing between healthcare and food because of the rising costs. It's hard for him as a doctor to be unable to answer to the suffering and the fear of his patients and his fellow colleagues, and he doesn't want to have to continue practicing in an environment fueled by fear. And so he advocated for an immediate solution that does not result in the loss of access of coverage, and where he sees fear every day on the front line. And so I imagine this actually resonates with a lot of you. And so next, I'm actually going to show you the elements of what a good story looks like and ways you can use your story to advocate for a better system. And so the element of that means that you need to follow a narrative arc. And so your personal stories really humanize the situation and the issue, and it is more memorable and impactful than policy analysis. So as an advocate myself, going into meetings with legislators and talking policy analysis, they can debate with me, but they cannot debate with you on your personal experience and your story. And so when you're following a narrative arc, it has a few elements to it. First is a background and clear setting. And so you really want to start with introducing yourself and establishing your credibility and a validator. So of course your name, your medical title, and your workplace. And then you go into the issue, defining the problem. And then you transition into the climax. What are the impacts this is having on the healthcare system and on your day-to-day life and your patients? And then you transition towards the very end to a resolution, a solution to the issue. And you link it to your personal story. And so, of course, the question or the ask, the solution that you are proposing and making is a repeal to these healthcare cuts and restoring the enhanced premium tax credits under the ACA. And there's a number of things you can do with your story, but it's important that you keep it short and sweet, no longer than 3 minutes. Now, of course, you can post your story. Things that you can do is you can post your story on social media. You can meet with your member of Congress and share your personal story. You can join a press conference or a speaking engagement, and you can work with organizations like ESP or Doctors for America to get linked into press conferences. You can also write an op-ed, or you can even offer yourself for an interview with a local newspaper or a TV station or a radio station. And so in this next example for a press conference, I keep in mind this is a 2.5 minute video that we're going to be watching, but it is a perfect example of a story. Press play, please.
And my name is Elena Callender. I am an OBGYN physician currently practicing in Maryland and Virginia. I'm also here representing Doctors for America, a national organization of more than 40,000 physician and medical student advocates committed to putting patients over politics. I've spent the last 19 years caring for patients through some of the most critical moments in their lives, through adolescence, pregnancy, childbirth, and beyond. What I can tell you is this: when people lose access to health care, the consequences are immediate and devastating, especially for women. And I've seen this when I've seen patients all throughout the years. Right now, thousands of women across the country are at risk of losing access to essential care. Some are newly pregnant and won't be able to continue their prenatal visits to keep their pregnancy healthy. Others may be in the middle of treatments for diseases like cancer and may have to choose between continuing treatment or keeping the lights on at their home or being able to feed their children. I've seen what happens when patients fall through the cracks. It is not just dangerous, it is life-threatening. And unfortunately, it's not uncommon. If these healthcare cuts are allowed to move forward, millions of Americans will be pushed off of Medicaid, and millions more will see their ACA premiums spike beyond what they can afford. That means fewer people getting screenings and preventative care, and fewer people having access to treatments that they need that may save their lives. This is more than just bad policy. It's a public health crisis in the making. Access to healthcare shouldn't depend on your income or your zip code, and it certainly shouldn't be sacrificed to fund tax breaks for billionaires. We have a chance now to do the right thing. We can defend Medicaid, lower costs, and protect the health of our communities. And I am happy to see this representation here of our congressmen and to see all of you here, and I appreciate you being here. And I want to just say that we need you to fight. We need you to fight for our health care. Thank you.
And so you can see this is a perfect example of a story following the narrative arc. Dr. Callender established her credibility as a doctor, a volunteer with Doctors for America. She went on to define the issue and the impacts that this will have on her patients. And then she had a clear call to action for Congress to repeal these cuts. And she kept it under 3 minutes. And so that is a perfect example of a story you can use to advocate. Next slide, please. And so in this clip, you are going to see a short, quick, easy video by a nurse that posted on her social media to talk about the impacts of H.R.1. Play.
Guys, the big beautiful bill is destroying healthcare, and it hasn't even gone into effect yet. I'm a nurse. I work for a pretty large institution, and we're not getting all the funding that was anticipated from the government, and everyone's just like buckling down and terrified because of the big beautiful bill and the cuts to Medicare and Medicaid, which, if you didn't know, was like essentially where hospitals get most of their money.
And so and then she goes on even more to talk about further impacts, but this is a good example of something that you can post on your social media and do really easy on your phone, and then just post from there. So quick and dirty, nice and easy, and then you can just post it on your social media. Next slide. And so this is an example of using an op-ed to share your story, or a letter to the editor. So you can work with Doctors for America. We're going to provide you with resources on how to write an LTE or an op-ed. And we can provide the support you need to get that published in any local or national newspaper. But this is just another example of how to tell your story to push for action. Next slide, please. And so I just want to currently we are in a stalemate in Congress here. And there are many, many, many examples of how using your story has really put pressure on Congress and brought many other members of Congress into this fight. For example, we have some great advocates in Nebraska that have been really pushing Representative Bacon. And because of that, Representative Bacon is now part of the House quartet, 4 members in the House who are trying to find a solution to this subsidy impasse. We also have worked with state partners in Virginia who are pushing Representative Kiggins, who has now come out with her own bill for an extension to the ACA tax credits. And we have lawmakers coming to us asking for storytellers to bring to press conferences and events as a way to apply pressure and to bring more members of Congress into this fight. And so there are a number of examples. These are just a few to name, but your stories have power and can have real impact. Next slide. So I just want to make sure we keep in touch. Here's my contact information. If you need any help with your stories, recording them, getting them out there, amplifying them, what to say, we are here to help, and you can contact me directly, or you can contact the panelists on this webinar for help as well. Thank you.
And we're going to open it up to questions, and so please add questions to the Q&A. We also want to just start sharing our feedback survey just to make sure that we can get insights from you about in this world that we're in now, where we need to arm ourselves with information and we need to arm ourselves with tools of how to kind of be able to really protect our patients and our communities, what else would be useful to you to know and to have shared from us? We want to make sure that we have that offering out to you all as we get into our discussion. And so I'm going to stop sharing so you can see all of our faces. And I want to open it up to all the speakers first by asking really a spot check question. And I think it's important because I think that the way that I would answer this from a lot of my colleagues, the numbers will be a little bit lower, but I want to kind of go around and have you say from a scale of 0 to 10, how hopeful are you that if we can galvanize healthcare workers, doctors, clinicians to be able to use their voices, tell their stories, that we can move the needle somewhat in terms of offering protections? And I want you to really level set with us. So 0 is don't even bother, stay in your bed, there's no use. And 10 is, yeah, it can make a huge impact if you just show up once and something will happen. I just kind of want to hear from, each of you of where you think this really stands, because as we talk and we ask people to do things, it's in the busy clinical day, it's at busy times, and I just want to get a sense of what we think this will actually do in terms of moving the needle. So I'll start with you, Mason, then go over to you, Layla, and end with you, Laura.
Yeah. I would say maybe I'm around a 7. It is definitely not as easy as just showing up once. Like I sure everyone wishes it was. And there's going to be stuff you say, actions you take, whether that is, a talk you have at your work or a rally you go to, where you're not going to be able to really draw a direct line to that and some real world impact. It's sometimes there's so many different causes and it's such a collective action issue that, it might be hard to say like, oh yeah, I made this speech on Monday and by Tuesday healthcare was solved. Um, but I do think that it's important to remember that even if you can't see that impact, social change is a collective action problem,
Mhm,
and there might be not any one talk, there might not be any one story, there might not be any one protest that we can say, oh, that's the one that flipped the switch. But we can say that if you didn't have any of them, nothing would happen, right? So
mhm,
it's important to remember that even if you don't see your impact, you're part of that collective movement. And also, the impact can be as simple as like, um, one person in your office or one friend
mhm,
or relative understand like, oh, wow, I didn't realize the impact this was going to have. I didn't realize how bad things were going to be for you and your patients. So it
mhm.
doesn't have to be testifying in front of Congress. It doesn't have to be a big speech. It can be a conversation over a cup of coffee.
Excellent. Thank you. Layla.
I say 10, 100% use your stories to affect change because, like I said, I am on the front line every day and I see the impact that these stories can have. It's what got Senator Schumer to be on the front line and actually stick his neck out and talk about healthcare. It's what got Senator Murkowski to introduce legislation. It's what got Representative Kiggins to also introduce legislation. And it's what's encouraging and forcing members of the Senate to come together in a bipartisan fashion to find a solution to the healthcare crisis and the cost of the ACA premium. So it's not through an advocate like myself, but it's through your stories and coming together collectively to share your stories. Mason talked about a collective movement and collective power. That power comes from organized people, organized money. And you put that all together, and then that's how you have power and you create movement and force change, effective, positive change.
I love it. I love that feeling that we can do it. Laura.
I'm also going to say 10 out of 10, but I think the results you get may not directly, it's a process.
Mhm,
And by that, I shared my story all over Nevada when I was diagnosed with cancer in 2017. And I did many, many press conferences and op-eds and letters to the editor and talked to the media and on TV again and again. Uh, we did not get Senator Heller's vote. He voted to repeal the Affordable Care Act again and again. But he is no longer a senator.
mhm,
So I think if someone is not a healthcare champion, if they do not listen to the people they represent, they may not have a job. So you will be heard one way or another. And I believe in this moment, we are going to make this bill's effects less terrible. Are we going to win everything? Are we going to restore $1 trillion in cuts and all of the various backdoor sabotage of the Affordable Care Act, of Medicaid, of Medicare, of our entire healthcare system, of is sabotaging our institutions from HHS on down, sabotaging our research funding? Probably not. But we will win some of these fights if we keep fighting.
And I have to say, as someone who sees patients in clinic and was just in clinic yesterday, there's something that's inspiring to your patients when they know that you are not just taking it laying down. Because patients are coming in and there's such this sense of the kind of, I had a patient who came in and the trans woman, and she said, I feel like my hormones are going to be taken away from me. I need to stockpile them, right? There's a sense of doom. And to be able to say, here's what we're doing, here's how we're showing up. I think exactly to the point that Mason made of the collectiveness of that resistance, it is powerful and it has an impact. We have a question from Eric Thethke, if you want to unmute and ask your question. I don't know if you can. I think someone might have to give you permission to. So let me see. Go ahead. All right, go ahead, Eric.
Hey, sorry, I'm driving, but I think the other thing is work with Doctors for America. I'm a pediatric cardiologist in New York out of Boston Children's. And I think we also have to acknowledge that right now there's some momentum that the government is literally dying on the sword of the healthcare issue. And the more that we add our voices to that, the more we encourage them that they're on the right track, or that we believe that this is worth the risk benefit of a shutdown. Everybody's saying from Republican side, well, we'll deal with it later, just open up the government, we'll deal with it later. But we've seen that before. And I think when we do these stories, not only do we push them, perhaps give them a little more support in negotiating, but we also tell them, we do believe this is just as important as you do, an issue to make an issue of this time of closing than we did before.
Really well said, Dr. Fenke. Thank you. And I think that this kind of gets back to one of the other things that we are really thinking about. Healthcare is a space that it's a captive audience because all of us are patients. All of us will interact with the healthcare system. And yet some populations, some communities are more negatively impacted when we talk about things that are happening, children, rural communities, women. How, and this is for Layla probably and others, just to think about, as we're thinking about framing these stories, how do we really put front and center the ways in which the inequities will play out, the inequities that reinforce systemic inequities that have always existed? What kind of responsibilities do you think we have to speak to some of these more vulnerable populations that, if we're all being left behind, some will be left behind even more? And anyone can take that, but I'll start with Layla.
Sure. So I think in using your stories, because you're on the front line and you see how these cuts will and are impacting people directly, you can kind of point out those impacts. So for instance, we know, as has been mentioned, like women are going to be disproportionately impacted because of these cuts. And so you can point to that and give examples of how you're seeing that on the front line. And then an advocate like myself will come in, like say I'm in a legislative meeting with you, I'll come in with like facts and figures specific to the state or the nation or the district, depending on who we're meeting with, to kind of support those stories. We also know there's going to be a great impact on like small business owners. And so you as healthcare professionals, I'm sure many of your patients are small business owners, and you see how the ACA really helped give them access to healthcare. And so you can kind of pinpoint those particular issues, or the cuts to Medicare and how that will impact the elderly and the disabled. I think you can kind of highlight those particular impacts when you're sharing your stories because you're seeing it firsthand.
I want to just maybe, instead of having other folks chime in on that, I want to ask a question from one of our attendees. It says, would you suggest making connections with state legislators in addition to members of Congress, given how it's really going to be a state focus for dealing with the fallout of these cuts? And I think that that question also relates to another comment that was made around what can employees do. Jan made the point that, in Tennessee, employees can fire individuals at will. So there's this question here of like, yes, the federal government has all this badness and all this intensity. What about at the state level, and what can we do at the state level? Because as we often talk about, all politics is local. How do we keep that in mind? And just curious about what you would kind of comment in about that as people are thinking about where they put their advocacy efforts.
Absolutely. Actually, because of these cuts to healthcare, we're actually states are in kind of like a budget downfall. And so they're going to have to start making cuts or find other sources of revenue in order to kind of fill in those gaps. And so Economic Security Project is already working with our state partners on what we're calling like state tax credit defense. And so having connections with state legislators and governors is critical in making sure that we have that defense that we need to make sure more critical programs are not eviscerated, essentially. So yes, 100% building those relationships with local, state, and federal officials, I think is very important.
I want to ask you, Laura, I think we kind of have a sense of the answer to this. There's been studies that have shown that individuals are more likely to donate to an individual who has a hardship than to hundreds of thousands of individuals who may, for example, be in a famine or going through some hardships. And so there's power to the individual stories. And I'm curious, as someone who had stage 4 cancer and went through and tells your story from an individual level, what kinds of stories do you think resonate most with lawmakers across the political spectrum? Are we talking about focusing on clinical stories, financial stories, individual stories, systems level stories? Just curious about kind of what you found in your own experience as someone who could really provide testimony to that.
So, to answer your question, a specific person, a specific story is always going to have more impact than a statistic. For example, we talked about the Affordable Care Act cuts and how millions of Americans will lose their health care. My insurance premiums are going up 21% next year. Can you imagine, everyone on this call, if you had to pay 21% more every month for your health insurance? What are you going to have to cut? What are you going to have to go without to pay for that? Or if you can't afford that, you're going to lose your health insurance entirely. So I think always real people and real stories have more impact than statistics, because it isn't just me, it's millions of Americans, including me, but it means more when it's me here, 21% increase.
On that note, I want to wrap us. I want to ask our speakers if there's any final comments you'd like to make. I am not that optimistic. I'm a New Yorker, and so I'm cynical, but I am holding on to optimism these days. And so, any kind of optimistic moments or points that you want to have us really think about as we come together and we wrap. And I'll start with Mason, then go to Laura, and end with Layla.
Yeah, I mean, I will say this. There's a lot of reasonable concern out there about employees, government, people in the public retaliating against people for speaking out about these issues. And the reason that is true is because people in power, the employers and the governments and the people who are profiting off things like this are worried, right? They know that that speech is going to move people and that it is dangerous for them. If they weren't worried about it, they would not be threatening punishment. So I think that's a sign that we are on the right track.
Amen. Laura.
What Mason said, they wouldn't be trying so hard to silence us if our speech didn't have power. So, I mean, there are real repercussions, as Mason mentioned. Speaking up is not without risk, but if you can, please do, because it will not get better unless we keep speaking out.
Thank you. Layla.
I'd say we just got some hope just 2 days ago with the elections results, because we saw people speaking up, sharing their stories, and talking about how things are just not affordable right now. And so I think that is a testament to what your voice can do. And so just keep going forward and keep sharing your story so that we can see a better tomorrow.
On that note, I want to thank you all for being here. I want to encourage each and every one of you to think about how you're using your voice and what we can do as a collective to help you to do that. I want to invite you again to think about Doctors for America as well as Civic Health Alliance as resources. You are not alone in this. If you're like, I want to do this, but I don't know how, part of what we did in the chat was to share all the resources because these things have been created and we can get them to you. Again, share your feedback. This is one of many conversations that we'll be having. We would love to be able to know what would help you in your role to be able to do this advocacy work, ultimately to make the lives of our patients easier and to get us back to what we need to be doing in healthcare, which is taking care of people who are sick, rather than being in a community that's making people sick and then asking us to really be able to heal that. So with that, thank you all. Thank you, Mason. Thank you, Layla. Thank you, Laura. Thank you to my DFA colleagues, and thank you all for being here today.